With a population of almost 45 million people, Tanzania is facing an ever-growing gap between urban and rural healthcare services. In urban areas, there is only one doctor for every 4,000 people, whilst in rural areas, only one doctor for every 100,000. Overall, there is a 68% shortage of health workers. This cripples the country's ability to tackle critical health challenges such as HIV/AIDS and maternal newborn health. Women bear the brunt of this double-edged sword. The national HIV/AIDS prevalence rate is 5.7, but women's rate of infection is higher at 6.3. Each year, almost 8,000 women die from preventable pregnancy-related conditions. And it is not surprising, with only 42% of women in rural areas giving birth in the care of qualified staff, compared to 82% in urban areas. As a result, we lose 38 infants for every 1,000 births. Prevention of mother-to-child HIV transmission is key in increasing the chances of a child being born HIV-free. There are 1,100 antiretroviral treatment sites that covers 18% of the facilities in the country. As more qualified and dedicated health workers work in rural areas, better access to treatment and care of HIV/AIDS for the 1.3 million people living with HIV is provided. To support government efforts to bridge this gap, the Mkapa Fellows Program was established by former presidents Benjamin Mkapa of Tanzania and Bill Clinton of the United States in 2005. A year later, a fully fledged foundation was formed, known as the Benjamin Mkapa HIV/AIDS Foundation, BMAF.
Because the hard-to-reach districts in the country were not very attractive to health workers, we had to devise a program that would not only recruit, allocate them to the rural areas, but make sure or facilitate their continued stay rather than their absconding back into the urban areas. And so that is how we thought of the Fellows Program.
90% of Mkapa Fellows have completed the program. 60% were absorbed by the government.
So the Mkapa Fellows Program, through the funding support from Norway government, was able to recruit the 99 fellows, health professionals, and we've been seeing tremendous improvement in the service delivery in those respective districts. But basically they've been working closely with the existing health workers in those districts and under the supervision of the district medical officer.
Benjamin Mkapa AIDS Foundation has helped me a lot. By working in this environment, I have as a doctor realized the needs of my clients. We have a saying that the best book is your patient. I have serviced clients with different health issues, and as a young medical doctor, I have experienced and learnt a lot from my clients.
Mkapa Fellows Program recruited 99 health professionals who worked in 33 rural districts, covering 25% of the country.
We asked the district AIDS control coordinator, how many AIDS patients do you have?
He had a few patients, probably less than 10. So we decided, let's begin with those who are available. Let us find out where they live. So we got ourselves together and looked for them. Before, AIDS patients were told to begin taking the ARVs while they still had enough CD4 count, just because they had been admitted in for a long period of time. But since Dr. Okio arrived, things have changed. The CD4 machine is available now, and if you have any problem, you look for Dr. Okio and he's available to help despite any duties.
Clients' turn-up was huge. I remember the first day we enrolled 30 clients, and it has been rising. To date, we have more than 100 clients.
In the past, the doctors were not that responsive to patients. They had given up on me and saw me as a waste of time, and that I wouldn't survive to see the next day. That's what they are thinking.
She was among the first clients
who were very sick with AIDS. And there was too much stigma among the society around her and the staff at the hospital. So conveying the message that there was an HIV client was very difficult among the staff because of the stigma.
Now our health have improved a lot from the services offered by the Mkapa Foundation. The medication and the food that I'm taking helps a lot. I do not have a husband, so this has made my life better. Even my little daughter, although she is infected, but due to the medication we're getting from the hospital, we have hope.
In the second phase, we plan to reach 2.5 million rural Tanzanians in 15 districts of mainland and Zanzibar. The core beneficiaries of the program will be people living with HIV/AIDS, pregnant women, and newborns. Mkapa Fellows Program, in collaboration with the government, will train 1,800 existing health workers in rural Tanzania, recruit and deploy 180 fellows, as well as build and equip 30 theatres. We need a team of 12 health workers per district, totaling 1.6 billion, that will include remuneration, training and outreach. To do so, we need 45 doctors, 55 nurses, 15 pharmacists, 25 laboratory technologists, and 40 health administrators. For example, one doctor costs 2.8 million Tanzanian shillings. That is 51 million for 18 months. To train the team costs 102 million per district. Building and equipping 2 theatres per district costs 148 million. The total budget for the program is roughly 15 billion Tanzanian shillings, or $10 million.
You can see that this was a very small venture to supplement the greater efforts of the government to deal with this serious threat to the viable growth of our society. I really do believe that although we have made some progress, far more than some of the neighboring countries, for instance, but we still have a long way to go. And we can hit better targets if we lend our hands in cooperation from the private sector, from the general public, and from the government upscaling its work against this terrible disease. I believe it can be done. As Mwalimu would say, it can be done. Play your part.